And welcome to Talk of the Town. I'm Robyn Zimmerman, along with Wayne.Boutwell. He is the CEO of Encompass Health Rehabilitation Hospital in Bluffton. Good to meet you, Wayne.
Thank you. It's great to be here.
So, inpatient rehabilitation is for those that have been in the hospital and aren't quite ready to go home yet. So they've been in acute care, stroke, maybe hip replacement, knee replacement, whatever. Kind of talk about those kinds of conditions that would lead them to
Absolutely.
Encompass.
So in inpatient rehab and at Encompass, we really serve as the next step for many of these patients who are suffering from, they've had a severe illness or a severe injury, like a stroke, a hip fracture, maybe an amputation, maybe some other complex neurological condition. We serve as the next step for them to help them progress towards independence. We do this really by offering physical therapy, occupational therapy, and speech therapy in a multidisciplinary type approach that includes physicians, nurses, therapists, dietitians, all who kind of follow an individualized treatment plan for the patient that again helps him or her progress towards independence. And we do this in such a way that goes a little bit beyond your basic therapy, because we include what we call activities of daily living, things that we might take for granted, right? Unless we have one of these conditions, like dressing yourself, grooming, cooking, things as simple as getting into and out of a car.
Right.
And so we help them with these things, again, to help them progress towards independence.
Well, and what we were talking about earlier is you have very intense therapy. So your length of stay might be shorter. That's right. But that patient is getting several hours of therapy a day, 5 days a week. Talk about that.
That's right. So it is a little bit of a different program. So our patients do get up to 3 hours of therapy a day, 5 days a week. It's very structured and it's designed to be that way. We do have a little bit of a shorter length of stay than maybe some of our lower level of care counterparts, like a skilled nursing facility or a nursing home. But it's good work, and I'll tell you, when I round on patients in the afternoon, they're tired.
They're tired.
Because they've worked hard.
Right.
But it's designed to do that, and it's designed to be that way, again, to help them to progress towards independence and to help them get home.
And so again, it's that next level of care so that they can go home and even perhaps have some home care after that. So you've celebrated a milestone? What is the milestone of Encompass?
So very proud to say that we recently celebrated 5 years since our hospital opened, serving the Lowcountry. We felt like 5 years was a bit of a milestone in our hospital's history, and so we wanted to do it up and do it right. And, so we had a little bit of a community event, and we had Mayor of Bluffton, Lisa Sulka, Harry Williams, and Mayor of Hardyville, our partners and friends at the Chamber of Commerce, Bill Miles, the whole team. We had some former patients and families show up.
That makes it extra special.
It was really nice to have them there. We had our volunteers, and of course our wonderful staff turned out. And we celebrated 5 years and all of the growth we've seen in 5 years. You know, we started in June of 2018 with about 57 employees. And now we have over 160.
Really?
That's right. And in our first year, the hospital saw about 200 patients. And we've grown so much that just last year we saw well over 900.
Wow. So Wayne, what are your future plans to perhaps grow, maybe add more space, more staff?
Well, of course, we want to grow with the community. There's nothing definitive just yet, but we have our eye on the market and trying to always serve the needs of the market, and we want to grow as our market grows. We are also, I will tell you and share with you, as we were recently certified by the Joint Commission, which is a premier accrediting body for a disease-specific certification in stroke care.
Oh, wow.
And so, you know, we feel like
that's very special.
Our stroke program is as good or better than we think anyone that you'll find. And we're currently working on building a Parkinson's program because we've seen some growth in the Parkinson's community in our market. And so we took a good hard look in the mirror and we said, how can we do better by the Parkinson's patients? And so we're building a Parkinson's program in partnership with the Parkinson's Foundation.
Thank you so much. Wayne.Boutwell with Encompass Rehabilitation Hospital of Bluffton. And congratulations on your 5 years.
Thank you so much.